Welcome, my name is Peter Strong. I'm a professional psychotherapist and I offer Skype counseling therapy online via Skype for the treatment of anxiety and depression and addiction and other common emotional problems that benefit from the approach of mindfulness therapy, which is what I offer during these online therapy sessions. So Skype counseling therapy is a good option if you find it difficult to leave your house. So of course I work a lot with agoraphobia and other anxiety disorders. It's also a good choice if you are living in a remote area or where there are no local therapists available. It's also a good choice if you prefer the greater privacy of having your sessions online, where you don't want to meet a local therapist. I also work a lot with people living abroad as well, who are looking for some help with anxiety or depression or other forms of emotional stress. The main thing when you're seeking any form of online therapy is that you use Skype or a similar video platform so you can see each other. If you can see each other, then Skype therapy is just as effective as meeting in person. You certainly don't need to be physically present to receive good quality psychotherapy. But you do need to see each other because that allows much better quality communication. So that's why I recommend using Skype. The style of psychotherapy that I offer online over Skype is called mindfulness therapy. This is a very effective way of working with the mind. Mindfulness describes a state of conscious awareness where we are able to be present consciously with the mind, with thoughts, with emotions, with memories, with trauma, without becoming reactive, without pushing painful emotions away, without grasping onto pleasant emotions, without avoiding emotional pain, and without becoming overwhelmed by emotional pain either. The goal of mindfulness therapy, which is a system of work that I have developed over the years, is to change the way that you relate to your emotions, and particularly to emotional suffering. It's very important that you learn how to develop a conscious relationship that's open and non-reactive. This is essential to allow healing to occur. The reactivity to painful emotions is what creates suffering and is what prevents healing. So that reactivity, such as avoidance and aversion or inner criticism and other forms of emotional reactivity to your emotional pain, all of these kinds of reactivity feed the underlying emotional pain and prevent it from healing. So the goal in mindfulness therapy is to overcome this blind reactivity. These reactive habits are subconscious in nature. They are habits that we acquire, often from our family, from our society, from our culture, and even from our religion. They are often very much against the experience of our emotional pain. There are forms of avoidance. So we need to develop a totally different relationship with our emotions, and particularly with anxiety and depression. The quality of that relationship is what will determine whether you heal or not. So in mindfulness therapy, we learn how to develop this quality of relationship with your emotions by meditating on those emotions. We do not use meditation to escape the mind. Rather, we use meditation to bring that much needed conscious awareness to the mind, because that is what consciousness is really for. That is why it has developed. From an evolutionary perspective, it has developed so that we can change emotional habits, and that offers a survival advantage. So we need to bring more conscious awareness to our emotions. This is the central focus of mindfulness. So we meditate on our emotions. We learn to sit with our emotions without falling into the blind, reactive patterns that have been causing the suffering sometimes over years. So we learn to sit with our emotions. When we can develop that independence and objectivity, where we can return to our true self, which is defined in mindfulness psychology as the observing conscious presence. When you can return to that state and see the anxiety as an object and not who you are, then we can begin the process of healing. So mindfulness is about developing direct, conscious awareness to see the anxiety or depression exactly as it is, without any reactivity, without even trying to accept it. This is a common misconception. Mindfulness is not about acceptance. It's about awakening. It's about seeing clearly what is there in front of you, whatever it is that you're looking at. This is very, very important, as being totally present with that experience. When you have established this quality of objective consciousness, then you can begin to help that emotion heal, if it's anxiety or depression, by exploring its structure, seeing how it works, and then helping to change that inner process that causes that anxiety or depression. There are really two main ways we go about doing this. We first of all look at the associated patterns of reactive thinking. Reactive thinking is the fuel that feeds anxiety and depression. It's the fuel that also feeds addiction. And it's habitual in nature. We don't really see what's going on. We just suffer the consequences of reactive thinking. Well, in mindfulness meditation, we are deliberately looking for that reactive thinking and looking and now seeing it consciously. And this changes everything. So we see we learn to see those reactive thoughts, we learn to develop objective consciousness towards them as well. So we see the thought arise, but we don't become seduced by that thought. We don't become entangled with it. We simply see it as an object in the mind. The second way that we can work with the mind is to look at the imagery of our emotions. All emotions are based on internal psychological imagery. Typically, when emotions are very intense, the imagery is very large and very close, and very often it's high in our psychological field of vision. That's why we often say that we feel overwhelmed, or that the emotion is getting on top of us, or we feel squashed by the emotion. It has to be in a high position in our psychological field of vision. This is all part of the imagery. It has to be large to be overwhelming. So when we start to see the imagery by looking, which is the first job of mindfulness, to actually look and see what is there, what is this anxiety, what does it look like, where do we see it, how big is it, what color is it, what shape is it, what's its texture, is it hard or soft? When we actually start to investigate its structure, then we can begin to change that structure, because it's just habit. That's all it is. Anxiety and depression are habits, and they're based on this habitual psychological imagery. We can change that imagery once we make it conscious. You can make the emotions smaller. You can move them to a lower position. You can change their color. If they're hot, you can make them cooler. If they're cold, you can make them warmer. There's lots of different ways that you can skillfully interact with that emotional imagery and help it change. The primary principle here, which is one of the principles of mindfulness therapy, is that when emotions heal, they do so by changing their own imagery. So this happens quite naturally. This is a natural way that the mind processes emotions. When they heal, the imagery changes. And this is how the mind is able to reduce the emotional intensity of an experience. If it could not do that, then we would be in a state of complete emotional overload. But emotions do resolve over time. And the way they do that is by changing their own internal imagery. The mind changes the imagery of the emotion. We can speed up that process during our meditation. We see the imagery clearer, and through developing our own inner intuitive wisdom, we begin to get a sense of what would help that emotion resolve itself and heal. So we might try making it smaller. We might try moving it further away, moving it to a lower level, changing its color, etc. When the emotion, when the imagery of the emotion changes, the emotion changes. And our job during meditation is always about discovering what leads to the resolution of suffering. That's what mindfulness meditation is fundamentally about. is derived from the Buddha's teaching, and the primary interest of the Buddha and his teachings was about awakening to suffering and the resolution of suffering. So it's very important that we understand that mindfulness meditation has a very definite purpose. It is not just blindly watching things. As one teacher said, if all there was to meditation was just sitting and watching things, then chickens would be enlightened. So meditation is about helping things heal. It's about re-establishing emotional well-being and balance by responding skillfully to the structure of your anxiety or depression that has essentially become stuck. We're trying to help that emotion become unstuck so that it can start to change in that natural way by changing its imagery. So working with imagery is a very important part of what is technically called the response of compassion. And that's one of the fundamental components of mindfulness. Mindfulness has a passive component, which is about the direct conscious experience of things. And it has an active component, which is the response of compassion, of healing suffering, of healing anxiety and depression. So this is a brief overview of some of the components of mindfulness therapy that I teach during these Skype counseling therapy sessions. If you would like to learn more, and if you'd like to schedule a Skype therapy session with me, then please go to my website and contact me through the contact form to get started. Thank you.